Hi, I'm Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. Today we are going to be talking about freezing eggs. Why do we do it? And what is the best age to freeze your eggs? What are the reasons for freezing your eggs? How is the survival rate? So we'll look at all these aspects and then you can conclude whether it's a good idea to freeze your eggs for various causes that you may be going through or your doctor has suggested you egg freezing for. So the major factor affecting the success of egg freezing protocol is age. As a woman ages, the eggs also age and the chromosomal arrangement inside the egg also are altered. So the statistics also reveal which is a better age to freeze the eggs. Let's look at that. A woman in her 20s is more likely to produce eggs which are capable of surviving better, giving better embryos and embryos that will implant and lead to a successful birth. This is because, as I said, the chromosomes inside a younger woman's eggs are better arranged than the chromosomes in an older woman's eggs. So the egg freezing protocol also therefore relies entirely on the quality of eggs which are directly related to the age. So the younger the woman, the higher the likelihood that the quality of eggs will be good. So women in her 20s will give us better success rate with egg freezing than women much older. So just not the quality of eggs, the number of eggs also make a difference. If you look at this study which was published in Fertility Sterility journal, you can see here that you need at least 15 mature eggs if you are under 35 for at least one live birth rate. Then your chance of a live birth rate is 80% if you freeze 15 eggs minimum. So the number of eggs also play a very critical role in the chance of having a live birth. And if you look at this slide here, you will see that as you age, that is if you're 35 to 37, you need 20 mature eggs for having 80% chance of having a live birth. So the more you age, the more number of eggs you require to have a live birth. And then if you're 38 to 40, this study says that you need 30 mature eggs to have a 75% chance of a live birth rate. So you can conclude here that the faster, the sooner you decide to freeze your eggs for various causes, the better it is for you. So if you're 40 to 42 years, you need more than 30 eggs for a 50% chance of a live birth rate. You can see here that age plays a very critical role. And the causes for freezing, the reasons why you may be suggested to freeze your eggs could be many, and some are personal, some are medical. Let's look at the medical ones first. Well, you could be someone who is diagnosed with cancer, ovarian cancer, uterine cancer, many cancers which require chemotherapy and radiation. Under such circumstances, post chemo and radiation, the quality of eggs may deteriorate, which is why your treating physician or your gynecologist may recommend that you freeze your eggs and then go for chemotherapy and radiation. Then there is the cause of endometriosis. In endometriosis, the quality of eggs deteriorate very fast, especially if the endometriotic stage is worse, that is grade 4 or so on. So, and if you're undergoing treatment, wish to have a child later, then the best option for you, if you're suffering from endometriosis, would be to freeze your eggs, undergo treatment, bring down the effects of endometriosis, and then go for a child whenever you wish in the future. Then there are these causes of polycystic ovarian syndrome also, where the eggs are too many but the quality is low. So the eggs are taken out from the body. The best looking ones, the most mature ones, are frozen and used in future whenever you wish to have a pregnancy. Then there are these other reasons which are not medical. Women nowadays want to pursue a career, want to study more, which is very good, and however, age also is very critical. You need to have a child at the right age so that you not only have the joy of motherhood sooner, also a chromosomally normal child at the right age. For such women, we recommend that they freeze their eggs in their late 20s or early 30s and have a child whenever they wish. It could be late 30s or early 40s. Now the issue here is, whatever age you freeze in, your eggs are frozen at that particular age. You can come back at late 30s, you can come back in late 30s or early 40s, your eggs will remain in the age that you froze them. So it's very easy for women to pursue a career now because egg freezing is now available. If you wish to understand more about this or wish to freeze your eggs, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.